The topic is of nutrition. What do you mean by nutrition? Nutrition means nourishment. Nourishment. How it is assessed? It is assessed by the following three parameters. The first is fat, subcutaneous fat. Second is muscle bulk. And the third is deficiency of vitamins, if any. Nowadays a new one more is being added, that is mid-arm circumference. So these parameters will judge whether the person is nourished or subnourished or malnourished. Mid-arm circumference. Types. What are the types of nutrition? Subnutrition. What is subnutrition? Subnutrition means when the body nutrition is less than 10% of the normal standard person in relation to age and sex of a person. It is generally quantitative nutritional deficiency, dietary deficiency. Second one is starvation. Starvation when it is less than 25%. Third is malnutrition. As you can see, the degree of nutrition deprivation is increasing as we go down from subnutrition, starvation, malnutrition. Malnutrition is these two where quantitative dietary deficiency, but while this one is a qualitative deficiency. Malnutrition when there is vitamins, mineral, essential amino acid is being characteristic. The deficiency of amino acids and all is characteristic in malnutrition. Cachexia is a combination of both malnutrition along with anemia. There will be visible features like anemia, evidence of vitamin deficiency will be there, and also feature of your starvations will be there. Now, if we come from subnutrition, few causes I would like to explain. The most popular among them is pulmonary tuberculosis. Second is diabetes mellitus. Now, pulmonary tuberculosis is because of the patient has completely the patient is having completely loss of appetite. Anorexia is there, as well as the whatever the patient is eating, that is not getting utilized, right? So that is the major cause of this malnutrition in case of pulmonary TB. Second is diabetes mellitus. Why there is subnutrition in diabetes mellitus? It is because loss of calorie due to glycosuria and malabsorption. It may be associated with some other gastrointestinal disorders. Few other are thyrotoxicosis, fever, if the patient suffers of fever, and malignancy. Now, you can see there is one thing common in these three: thyrotoxicosis, fever, and malignancy. Yes, it is increased metabolism. The metabolic rate is quite increased in these three conditions. Now, coming back to the types of your nutritional problems, it is the fifth one is emaciation. Emaciation when there is a complete lack of subcutaneous fat and diminution of the muscle bulk. Now, this one many will not consider in nutritional deficiency, obesity, that is excess, no. But if fat is adipose tissue is excess, other will get deficient. So it can be of two types, primary and secondary. Primary, there is no known cause, it is idiopathic. While in secondary, there are many causes, especially endocrinal, like for example Cushing syndrome. I must tell you about hypothyroidism and insulinoma, pancreatic insulinoma, where the fat digestion is being altered, insulinomas. and few drugs like insulins and oral hypoglycemic agent, abnormal distribution of fat. There are many like Prader-Willi syndromes. All those are the secondary causes of obesity. Now there is something called nutritional obesity, nutritional edema, not obesity, nutritional edema. This is seen in wet beriberi, also in epidemic dropsy. Epidemic dropsy. Now the last one is protein energy malnutrition. Here you all know about Kwashiorkor. What is that? It is characterized by retardation of growth, wasting of muscle. The growth is retarded. There will be wasting of muscle. The hair will change in color, gray, lusterless hair. Pigmentations will be there. And it also be seen in prolonged breastfeeding. Nutritional marasmus is seen in under 1 year of age, retardation of growth, loss of weight, wasting of muscle. 1/5 to 1/3 of the body weight is lost and face is pinched and has a curiously senile expression in nutritional PEM. It is seen in less than 1 year old child. Then there is one more variety which is known as Marasmus Kwashiorkor. Children have features of both Marasmus as well as Kwashiorkor. So this was something of Kwashiorkor. This is Marasmus. So here the features is the child will look apparently healthy in growth, sunken eyes, and this one nutritional PEM is nutritional malnutrition, Marasmus. So this is all for today. Thank you for watching.